I'm Milton Schoen, and welcome to America Salutes. Today we have Patrick Kelly, who's the director of the Minneapolis VA Medical Center, and welcome.
Thanks for having me back, Milton. It's nice to be with you again.
It's great having you on our show, there's quite a bit has changed here in the last year, and we are sitting at the Common Bond housing site at Upper Fort Snelling. Now, the VA owns the property, and why don't you tell us a little bit about the role of...
Great, so thanks for asking, and this remains one of the highest priorities for the VA and for veterans. And so about 15 months or so ago, we came here and we cut a ribbon to turn these, what were horse stables, into studio housing for single veterans, and then there are also some family units over here for four families. So this is a part of a national program where the VA owns properties, to include this property here at Fort Snelling, that was not occupied, and that we had developers around the country, and in this case Common Bond, which has been an unbelievably great partner, in supporting this program and this services. In fact, we were the first project to use this Burr Housing Initiative in order that we could get veterans who had a need into available housing, convenient to the medical center, where they can get supportive services. And so again, we are on October 2nd going to cut the final ribbon, but veterans have already started moving in. And again, it's a great initiative. We've had great partnership. Always MACV, the Minnesota Department of Veterans Affairs, our county veteran service officers, many people played a role in making this happen. But this is, again, part of our initiative to get veterans at risk for homelessness into homeless quarters, into housing, and supporting their needs so that they can be successful.
And it's efficient that the VA chose to use underutilized resources, existing property, and utilize that instead of going out and purchasing property.
Absolutely. So this was a significant overhaul to get these what used to be stables into housing units. But as you can see, it turned out well, and we just talked to a number of the veterans here who are now living here, and they are really pleased with what they've gotten so far, and I think Common Bond will continue to do just a terrific job in supporting those veterans.
And I'm sure Kevin and our fine staff here from Channel 6 will have some pictures of the before, and those pictures of the before are very telling.
They're very telling.
Humans didn't reside here.
Right. Well, when we did the opening, Senator Franken was the guest speaker, and I remember very clearly his getting to the podium. It was right out here, and he turned around and looked at the building and commented, "Gee, it's great to have this nice new building for our veterans." And he turned around, and there were those horse stables. And so it's interesting to see. We'll see it 15 months later, and we'll see what it's turned into. So it's been a great project.
Very good. And speaking of homelessness, that's one of the major initiatives of the Secretary.
Right.
And I've done this long enough that I know since the late 90s until now, homelessness has been cut basically in half amongst veterans. Right. And President Obama has increased the number of HUD-VASH vouchers and grant and per diem funding, and it's given you the resources to deal with people who have the most difficult issues.
Yeah, so in Minneapolis, or in the metro area, in fact, it has been cut in about half. Those are the same sort of statistics locally that we've seen nationally. And we have 570 vouchers in the state of Minnesota for our veterans. Every time we give out a voucher, for every 25 vouchers, we hire a caseworker. So it's not just money, it's people behind them, it's supportive services, it's educational support, it's job support. It's if they need addictive services, again, that's all part of making the veteran successful, because it's got to be more than just giving them a roof to live under. Giving them a roof is important, but there's all those other things that really make them succeed. Again, Minnesota Department of Veterans Affairs has a nice registry now for homeless veterans. We are reaching out one by one and trying to get any more veterans who have not gotten the services they need. And there are still veterans to be reached, but we've come a long ways.
And the medical center, as I understand it, out of $8 that are spent in HUD-VASH, out of $8 is case management, which is a medical center, and 7 of 8 is the housing subsidy that comes through HUD. And there's a story just there, having two departments working together to solve a problem.
It absolutely takes many community partners to do this. And so when we had this opening ceremony here, I remember very clearly, I got up and I was speaking and I was talking about our homeless program, and I commented that you know, I thought that we in the VA owned veterans homelessness and solving the problem. But I saw 20 community partners out there, all of whom took it equally seriously as we did. So lots of resources, lots of dedicated people working to solve this problem, including our two mayors in Minneapolis and St. Paul, who have vowed to make to end veterans homelessness in the state of Minnesota, or in their cities. And so we've come a long ways.
Very good. Now, there have been a number of controversies since the issues arose over the Phoenix VA Medical Center and access to care. And I know the VA has done some significant changes to what they do. In fact, they audited every hospital, and you had to take a look at your business practice. Why don't you tell us a little bit about what your medical center, what we've been doing to change in the last year?
Yeah, so that's a great question. So we, in Minneapolis and in one of our community-based outpatient clinics in Rochester, there were scheduling issues identified, and we had a independent surveyor from the Joint Commission come out and review our processes to make sure that we were on track with the Secretary's initiatives to get it right and to get veterans in here quickly. Those were successful, but again, it's in our access, which has always been pretty good, continues to be good, but we have to make sure that we are hearing our veterans and making sure that we are hearing what it is they're telling us that they need and when they need it and where they need it. And we need to be very transparent in the work that we're doing. So we have increased, we do town hall meetings quarterly. We did an open house recently. We have increased the number of advisory boards that we have. These are veterans who come and tell us what they need and how we can help them. We've continued to have a very strong relationship with veteran service organizations and our county veteran service officers to make sure that, you know, those people who are out there hearing from veterans every day and really know what they need and where the gaps are have a clear line of communication to us and to us. And so we have very intentionally tried to expand our services in the direct care system, in our facilities, both in our community-based outpatient clinics and at the Minneapolis VA Medical Center, so that veterans who want to get their care with us have good access. And as I said, our access to our mental health services is some of the best in the country. We are very, very fortunate with our mental health access. Primary care continues to be very, very strong. We have some gaps in some of our specialty care services, and so some of the most well-known by veterans in our area include audiology services and eye services, where you know, eyes and ears, that business has grown so dramatically over the course of the last many years that we have struggled to keep up with that, and some of our orthopedic specialty services. And so while access is good and continues to be good in our area, we have room for improvement, and so we're doing a few things to make that better.
And it's not as simple as just managing VA employees, because as I understand it, some of your community-based outpatient clinics are contract providers. So if you're going to resolve this problem, you've got to both work internally and externally.
Yeah. There are many advantages to having contracted CBOCs, to include in some cases, their ability to have a national reach to bring providers in to provide care in some of our remote areas. But there are also at times less flexible options for us to make changes quickly because they're based on contractual relationships. But we have good partners, and again, we've made some changes in some of our CBOCs, and we've been very fortunate in the last year that physician recruiting has been good. And so we have very few gaps in our community-based outpatient clinics now, where when we talked a year ago, we had some significant recruitment issues for physicians to meet those access standards. Today, we are in good shape with respect to providers in our community-based outpatient clinics.
Very good. Now, the VA Choice Program was initiated, and essentially, if you live more than 40 miles away from a VA healthcare facility, or if you are not able to get an appointment within 30 days, one can qualify for this. So maybe you could inform our viewers a bit about this program, even though in my county, Hennepin, it doesn't affect that many people.
Well, that's a good question, and that is by far the most common issue we hear about now when we go out to town hall meetings, or when Congressman Nolan and Congressman Walz were just up in Hibbing and Duluth, and that was really sort of the focus of their discussions with veterans about the choice program. So as you point out, Milt, it was intended to be for veterans that are out 40 miles away from a community-based, from any site of VA care, and greater than 30 days for an appointment. And so it has been a rough start. And as I talk to veterans groups, I want to be very clear that it's been a rocky start, and I'm very optimistic that it will be better. And in fact, Congress has told us that they want us to consolidate all of our community-based care programs into a single program to minimize and eliminate the confusion for veterans, because we have what we think of as traditional non-VA care. We have the PC3 program. We have 7 programs now that provide some sort of community-based care. Veterans are confused. Our staff is confused. The contractors are confused. So part of an improvement that veterans will see over the course of the next year is that we will have a single program with a single set of rules. And I think the third-party administrator, in our case it's HealthNet, they will get better and more mature at handling this. They had to stand up a program, a large program, on very short notice, and they've not had all the staff or all the answers that we would have liked or our veterans would have liked. We too, in the VA, again with the new program, we've had to bring on new staff, teach them new programs, and we sometimes have given conflicting advice to our veterans, and then finally veterans themselves, who are accustomed to programs being a certain way, and traditionally we have effectively just bought the care for the veterans in the community. We spend $100 million a year buying care. Now we're requiring a deeper level of veteran engagement, to contact a third-party administrator, to be familiar with the co-pays that they may be dealing with. And that's been a change for our veterans too. So between those three, and the quick program standing up in a very short period of time, it has not been a good start. And again, I want to specifically be clear on that to veterans, and I want to apologize in those areas where they have not had the customer service that they're accustomed to getting when they're dealing with the VA, because whether it's the contractor or whether it's the VA, we own that program. It's our responsibility to make sure that it's a good program and it's working well. It has not worked well so far.
Well, the VA is rated higher than the private sector in terms of its delivery of care, but it's not perfect.
Right.
And you're not, if I'm hearing you right, you're not resting on your laurels.
Right.
If you have issues, you will deal with them.
We absolutely will deal with them, and I think when we have issues and when there are problems, we need to own it. We need to say, look, this is something that, we have 100,000 veterans, we have 900,000 appointments every year, we have 3,500 staff, and we have 14 sites of care. When things don't go right, and there will be times when they don't, we need to make sure we are owning the problem, recovering, and making sure we're making it right so the veteran gets everything that they're entitled to. They've earned this, and we need to make sure we're giving it to them.
Well, how are the wait times at the Minneapolis VA Medical Center and your community-based outpatient clinics?
They're actually good. And so our mental health wait times are some of the best in the country. We have really had a good success in filling all of our positions, both in Minneapolis and at our clinics. Primary care, again, is on balance good. There are some sites, Hibbing I will cite as one, Mankato is another, where sometimes we've had some recruitment issues that have caused us to have some delays. But now, as we talked about earlier, recruitment has been good, and wait times are far better than the national average. We've struggled some with some specialty care services, again, especially eyes and ears and a little bit of orthopedics. And where we have struggled, we have done some very specific things to improve the access. And so our goal is to make the access better in our system, and then use the community care where a veteran either chooses to use the community care or we can't meet the standard. And we want to make it so that we can meet the standard, so we can get veterans care in our system within the standard, so that they are familiar with it. Those who like it can keep coming to us, and we can take care of them in our system.
Very good. And earlier you addressed one of the Secretary's priorities on homelessness, but there are several others, and one of them is the backlog in claims.
Right.
And you were telling me earlier there's been some substantial progress there.
I really have to take my hats off to my VBA colleagues in our regional office, specifically here in St. Paul, where across the country they've reduced the claims backlog 84% in the course of the last 2 years. Pretty phenomenal. I mean, 2 years ago they had 600,000 open claims, and now it's less than 100. So again, whatever they're doing, I got to drink some of that, because they are really getting it right. So my congratulations to my VBA colleagues, and Kim Graves, the regional director over here, because they're really doing a good job, and I think veterans have noticed that. The other priority that we are more directly involved in and working on is this issue of increasing access to our services. So ending the backlogs claim, and ending the veterans homelessness, reducing the backlogs claim, and increasing services, and that's really the sweet spot for the Veterans Health Administration. and an area where we've put a lot of both resources and staff into solving that.
Well, and I understand that whole accessibility issue. It's a challenge to spread your resources out and to be accessible to people so that your services are meaningful. In our office, we're regionalizing, and we provide service by appointment at Brookdale, Ridgedale, and Bloomington, and Eden Prairie, in Mound, and in September we will start in Maple Grove. And it's a challenge, but our customers are there. It's challenging for them to come, as many of your customers, it's challenging to come to Minneapolis, to the medical center, and you need to provide the services at an accessible site for them.
Right, yeah, I mean, we have 13 community-based outpatient clinics, and now over 40% of our primary care and a lot of our mental health is done in those community-based outpatient clinics. And that means that the veteran doesn't have to drive from Rice Lake, Wisconsin over here to get their health care. We also have a very good and mature telemedicine program. I was just visiting some of our clinics yesterday. And a lot of our clinics where we have a little bit of excess capacity, let's say in some mental health services, we have veterans calling in from any other site. So it's not just calling into Minneapolis, but somebody from Rochester might call into Albert Lea, or somebody from Rice Lake might call into Duluth in order to get services, because that's what telemedicine allows you to do. It doesn't matter where the veteran is, doesn't matter where you are, it's just bringing them together and making sure that the veterans, one, that their needs are met, and two, we're minimizing their travel and the inconvenience that they experience with all that travel.
So if somebody, let's say, had an anxiety disorder, part of the issue is if they've got to come into the traffic in Minneapolis from a rural setting, that's not exactly helpful to them?
That is not helpful. Well, you know, we have as you may know, we've tried to minimize that discomfort for our veterans who come from rural areas into the Twin Cities, and I absolutely appreciate that. We opened our parking ramp a little over a year ago, and we added 520 parking spaces. And as I observed it, you know, at first veterans were sort of reluctant to go into the parking ramp, and some expressed a concern that it was going to fall down, you know, so they didn't want to use it. And what I have since observed is that parking on our campus has improved dramatically. So staff, veteran parking, I look out every day out my window to look at the ramp, and we have not yet filled the parking ramp, but veterans are using the parking ramp. You know, it helps them get to their appointment on time. They have reliable parking. They have access to elevators and to help them navigate their way through. And we now have a project to cover the area between the parking ramp and the main hospital, so that in the winter, veterans can have a covered area. It won't be open yet this winter, but we're building that so that that'll be covered, all that area where they're walking from the parking ramp into the building, and that there's no ice on the ground, and we're sort of minimizing any risks for veterans
and
moving.
The accessible parking is closest to the medical center.
Yeah.
So if you've got a van, you can park immediately adjacent to the medical center.
Right.
And as I understand it, you're going to be building a Skyway link so that in all kinds of weather, people don't have to be outside.
We will eventually have that. So one of the constraints with VA construction is that there are sort of thresholds, and so once you get over the $10 million threshold, there are certain things that you can't have on your project. So we will eventually have a walkway as well. For the meantime, and in the short term, from the first floor we'll have the covered walkway. But I hope to eventually have something from the upper floors to transitioning into the medical center, which will make it even more convenient for veterans.
And this was focused on your customers because, as I understand it, during the normal day hours, if you're an employee, you don't park in that. It's only for the patients.
That is right. We specifically have called that the veterans parking ramp. So we open up to staff after, I think, 1,400 every day, because we now know that most of the appointments are done or they're there. So any remaining parking spaces for the night crew can park there, but that is very specifically intended for veterans. And we have ample staff parking space further away, but ample staff parking space on the campus for our staff to use.
But you're focused on who you're serving.
Oh, it's for veterans. It is absolutely for veterans.
And you recently opened a new eye clinic, and could you tell us about that?
So July 6th, we cut a ribbon on a brand new state-of-the-art eye clinic. For those who come to the medical center, it's on floor 2E. But we went from 18 eye lanes to 30 eye lanes, 33 eye lanes, and we increased our staff, and our output is going from 120 patients per day in our eye clinic to 200 patients a day. in the short term, and we think that can get even higher. So as I mentioned before, eye services, optometry, ophthalmology is one of those challenging areas where we've had difficulty meeting our access standards. So this new service, and we hired this great physician from the Phillips Eye Institute. I mean, we really have good, high quality staff in a brand new workspace, new processes. We did some great simulation to make sure that patient flow is working, and we're seeing as many veterans as we can. That has already made a big difference, and will get only better.
And you mentioned the partnership by having somebody from the Phillips Eye Clinic. You also have a partnership with our land-grant university, the University of Minnesota.
Oh, yes.
And there's a tremendous partnership there in terms of training physicians and sharing resources.
Yeah, the VA nationally, 70% of physicians in our nation have had some training at a VA. You know, the great thing about that, some of those physicians, they're of course terrific physicians and teachers, and our training program is very important to us. But also, you know, when they have exposure to the VA, and even if they don't come to work for the VA, now they go to work out in Virginia, Minnesota, or Albert Lea, they've now had some experience with veterans and some of the unique issues that veterans deal with in healthcare. And they now are more suited to try to address those issues, or they have contacts in the VA, so they know how to get those veterans into our system. And so it makes a big difference in a state like ours, where they have exposure to VA services.
Well, General Omar Bradley pushed and adopted that, and his thinking was the research medical facilities at the universities, they could, the partnership would work, and the VA would have access to cutting-edge care, and I think that's exactly what's happened.
Yeah. So you know, we have been in Minneapolis since 1920, the VA healthcare, and we were the second VA with an affiliation with one of the universities for this very purpose. And you know, our doctors like it, our staff doctors like it, because they get to train residents and medical students, and the same is true with nurses or pharmacists or physical therapists. So a whole group of trainees that really keep our providers sharp and allows them some academic affiliation that really makes it attractive to work for the VA. So there's a lot of advantages, but we bring over some really excellent physicians who do work in our facility too, surgeons and others, that we couldn't do it without them. So that's an important relationship.
Well, we got 4 teaching hospitals in the metropolitan area, and the University of Minnesota and the VA are 2 of them, and they're in partnership. So that's quite a statement.
It's been a great partnership.
You know, looking ahead, you know, what are you planning in the upcoming year, and what changes may we see in?
Good question. So we are going to continue to try to increase services in the VA Medical Center in order that veterans can come to us, and we can continue with our high quality of care, but make sure we meet all those access standards too. One of the areas where we have become very focused is in the area of management of veterans' pain. So half of veterans have some sort of a chronic pain issue that they're dealing with, and demand has really grown. And so think of it as 3 parts. There's when you're working with your primary care doctor who's trying to manage your medications, make sure that you're getting what you need and managing your pain. We also have a pain management service, which we stood up this past year, and we hired 30 staff in the last year, including we used to be the director of the chronic pain management program at Rochester Mayo. She is now leading our program here, and we've hired 30 staff, physicians, support staff, and others, to increase our pain management consult services. And this year, we are moving our compensation and pension exam section over to the Whipple building so that veterans will get their C&P exams over at the Whipple building, to include new audiology booths and other services over there. What that's doing for us is it's opening up those spaces, and we're going to then introduce our chronic pain management center. So it'll be a residential program. Veterans can stay here. We have a 4-week program now, and we're going to increase that program so we can bring more veterans into Minneapolis, and we can put them through this 4-week program. For those that have the most difficult enduring chronic pain, which I think needs to be addressed in a very focused and concentrated program. So chronic pain management is an important issue. The Star Tribune ran an article on that several months ago, and there was a big meeting here in Minneapolis yesterday, including the governor attended and a lot of academicians and practitioners. But dealing with pain in the VA and in the private sector is getting to be an issue that we all need to take very seriously, and we've got a good program in Minneapolis. I'm proud of the program.
And the simple answer of just giving somebody opiates has led to many problems in our, both in the military and in our healthcare system. And I think this is an example of an issue that you've looked at, that it's a real problem and that there's a better way of doing it. I know we've got a veterans court in Hennepin County, and issues of addiction really can destroy an individual, and it's important that as a healthcare institution that you think of, the long-term impact.
You really have to think of sort of the whole person, the whole veteran, and so those veterans who've become addicted to narcotics or opioids, it's a difficult problem, and it's not a simple matter of just taking away the medications, because that leads to a whole series of other problems. And so, other integrative health strategies include, chiropractic and acupuncture and things that people don't often think of, yoga, meditation. I mean, we recently had a study published by one of our great researchers that described the relationship between post-traumatic stress and mindfulness training or meditation, and showed that veterans' compliance with some of these programs is significantly higher and has better outcomes than some of the traditional programs where veterans have a higher dropout rate. It's kind of like when we start our exercise program. If you start out trying to run a marathon in the first month, you lose interest and you quit. We're trying to do programs that are enduring and that veterans can tolerate and that can make them successful. But it's really addressing in a long-term strategy the whole health needs of the veteran, because it's complicated and requires a lot of resources to be brought to bear to make sure we're doing it comprehensively.
And you just don't deal with the easy issues.
If it was easy, we would have figured it out and fixed it, but as a nation. And so it is a problem. But I think you have to try to do the right thing for these veterans, and the right thing is, in this case, the hard thing, because a lot of veterans, of course, would prefer not to have to change their opioid dosage, but we think it's important for their safety to do so. But we have to have supportive services to make them successful too.
Right. Well, in our last half a minute or so, if you want to leave our viewers with a thought, I guess I would mention at Hennepin County, we will, in the A level, there will be a display that will be starting Labor Day weekend. And it's the 80-30 project. We have 21 veterans a day who commit suicide, and this is an attempt, and the awareness on this issue that is pushed in the fall. But we're trying to make people aware and deal with it. So any last thoughts you'd like to leave our viewers with?
I just want to thank our veterans. And again, I know that healthcare is complicated, and I think getting the healthcare when you need it and where you need it is something that is absolutely our target every time. And when we miss our target, we want to make sure our recovery is good and adequate. You can be assured that healthcare will be of the highest quality at the Minneapolis VA Medical Center. It will be accessible, and if you're not getting what you need, see one of our veterans advocates, because we want veterans to get the care that they need.
Well, I want to thank you for your service in the
pleasure.
United States Navy,
and
the service that you bring to our community each and every day.
You're welcome. Thanks for having me.
Thank you. And for America Salutes, I'm Milton Schoen, and thank you for watching.